Professor Lewis. My name is Rebecca Johnson. I'm getting ready to perform my skin, hair, and nail assessment for Chapter 12. I've just entered the exam room. I'm going to introduce myself to the patient. Hi, Odessa. My name is Rebecca. Nice to meet you. I understand you're here for a skin check and kind of an overall assessment. First, I'm just going to wash my hands here. All right, and then I'm going to put on some gloves. All right, Odessa, so we're just going to kind of start with the different body parts at a time, just kind of taking an overall look, okay? First of all, Professor Lewis, I noticed that Odessa has nice, dark, and more olivey skin that is consistent with her nationality, which is Filipino. I'm just going to kind of take a look here. Skin seems very smooth, and I don't see any abnormal lesions or anything. Just going to kind of check around the neck, not seeing anything there. Nothing there. I do notice some freckles, which are consistent, and she has told me that she's had those and no concerns there. I'm going to move to the arms here. Just kind of looking inside and out. I don't see any abnormal redness or lesions. So let's kind of check the other arm here. Same thing. Looking under. I'm not seeing any areas of hyper or hypopigmentation. Everything looks really good. Skin is warm and smooth, and hair is evenly distributed on both arms. All right. I'm going to go ahead and take a look at her legs here. I'm just going to pull this out, Odessa. Want to take a good look at the knees. Yep. Any swelling or noticing any fluid building up there? No. How about in the ankles?
No.
Okay, again. Legs are very smooth, hair is appropriately distributed. No concerns with lesions or anything here. I do see a bruise here. Did you bump your leg?
Yeah.
Okay. So no problems with any abnormal bruising or anything like that? Okay. And we're just going to check here. Pedal pulses are good. Feet are warm also. Skin is not abnormally thick. All right. I just want to take a look at your back here, Odessa. So, all right, and any abnormal lesions or anything here? Have you taken a mirror and kind of looked in the back, Odessa?
Not really.
No, okay. Well, I'm not seeing any moles of concern or any lesions here either, but it's always just a good idea to kind of, if you have to hold up a couple mirrors or things like that, just so that you can be able to see, because that's a hard area to see. All right. And any problems with any varicose veins or anything like that? Any areas of redness that you want me to take a look at? I didn't see any. But you've not had any problems?
No.
Okay. All right. So then I'm going to go ahead and check out your hair. Just going to put on another pair of gloves here. And what I'm doing, Odessa, is I'm just going to kind of feel around and see hair's texture is smooth. Have you had any problems with hair loss or anything like that? No, okay. Just going to kind of feel in the back here. Not feeling any abnormal lesions or spots. There's no abnormal hair growth or areas without growth. Have you felt any bumps or anything like that? Any pain when I'm doing this, Odessa? No? Okay, good. All right. Skin is good there. All right, yep. Okay, I want to just take a look at your hands here. Good, okay. I'm going to check some skin turgor. That's just making sure hydration is good. Good. All right, no abnormal spots here. Any areas that are concerned of dryness? No. Hands seem very smooth and good. Nails are the right shape. Color is pink. Just want to check something called capillary refill. That's something that we would like less than 2 seconds. Good. Cap refill is good. Same thing on the toes. We just kind of tap here. Good. Okay, that is just wonderful. All right. So Odessa, everything looks, overly good. I just want to kind of have you put up your leg a little bit, yep, so I can see underneath. Good. No area underneath there. Good. Okay. And then what I'm going to have you do, Odessa, is I'm going to turn my back to the camera here for a little bit. We're just going to kind of open that gown in the middle. And then go ahead and just kind of check out the stomach and that area, looking for any abnormalities. Have you noticed anything abnormal here? Okay, good. All right. Okay, so go ahead and sit back up. We're not seeing anything really too concerning. So just for future reference, when you're at home, we like to do an overall skin assessment. So we want you to look in the mirror, paying close attention to the lips and the mouth and, you know, any mucous membranes opening up and looking. We want you to make sure that you're checking the arms out, you know, looking underneath. You can see that I'm covered here, but that's the kind of things that we're looking for. Same thing with the legs, making sure you put them up on a stool to check underneath. Those are the areas that we don't get to see very often. We also want you to take a mirror, like if you're standing in front of a mirror like this, we would want you to take a mirror here and a mirror here and look at the back and the buttocks, any abnormal redness, bruising, any abnormal lesions. If it's a mole or a new mole, we like to pay close attention to that. There's a mnemonic, A, B, C, D, and E. So those are some ways that you can remember when a mole becomes abnormal. A is asymmetry, B is border, color, the size. If it's bigger than a pencil eraser, we'd want to take a closer look to that. We're also looking for elevation, okay? So that's just some general rules of what to do, but it's very important to look at things, especially if you spend a lot of time out in the sun like you said you do. It's important to wear sunscreen. Do you have any questions for me? No, okay, good. So everything looks really good. Like I said, no areas of hypo or hyperpigmentation, no bruising, no redness. So that would complete the assessment for Chapter 12.